Good afternoon. My name is Jeanette Cadell, and I'm a student in the Postmaster's DNP program. And this is NU 715. And this presentation will be implementing a type 2 diabetic comprehensive educational website for healthcare providers in a rural health clinic. So the organizational priorities and goals, they strive to provide innovation, quality patient care, and individualized patient care and compassionate care. At the end of the day, they try to do what is best for the patient to help them to have a better quality of life and a better outcome in life. So the quality vision for the organization, this particular clinic has a few nurse practitioners and medical doctors that all um, they try to remain abreast upon the current literature and practices for patients that they serve. And then my project that I am implementing, which is to increase their knowledge about educating type 2 diabetics, this all aligns with their vision for the organization. So the Quality Improvement Committee will consist of myself. I will lead the Quality Improvement Project. Um, and then on the team, there will be a medical doctor, a nurse practitioner, the office manager, of course, and a receptionist. Um, and also an RN if there is one available at the time. Usually there aren't any RNs at the building at the facility, but sometimes there are. They may pull an RN if they are short on um, the medical assistants. So this committee will oversee the project, and like I said, I will lead, and then I would have the providers and everybody to attend a weekly meeting in which we would discuss everything from the implementation of the project to how it's going with the doctors, provide having the educational session done, their pre and post test done, and then for the providers to provide education to the type 2 diabetic patients. And like I said, we will have a weekly face-to-face meeting in a conference room at this facility. We will also have a yearly retreat to discuss any data collected. We will also have a statistician on board, which is already employed at the organization to assist in um, analyzing data to ensure that all of the numbers are leading in the right direction, and if they're not, to what we need to change. So the problem identified was that there was no educational plan for healthcare providers at this particular clinic. They basically used information that they learned while in school to provide education to patients. So the purpose of this implementation is to increase their knowledge on how to educate type 2 diabetic patients. So OJ ETAL in 2018 performed a descriptive cross sectional study and found primary care physicians had a decreased knowledge of diabetes mellitus self-management communication. So meaning that there was a lack of break of education to patients. So the plan of action would be to develop this educational website to assist in the healthcare providers, assist them to increase their knowledge or improve their knowledge. So while doing this particular plan, a policy and a PDSA was developed to ensure that the protocol would be followed to the T. So this policy will be sent up to every leader in this particular organization. We will first implement it within the clinic, and if it's effective, we will move it over to the hospital. So resource allocation. So I could foresee this project costing maybe about 500, probably less than that. You can look at paper costs for printing of the test, pre and post test. And if, of course, if the providers or nurse practitioner wants to print out a copy of the actual website information. So that would probably be a cost. And then, to just make sure that the data is analyzed correctly by the statistician that is on payroll. Um, as far as long-term savings for the clinic, I think there will be none. However, for the hospital, this will, is if the providers can provide this education to the patients and the patients take adherence to the education, this will decrease any kind of diabetic associated complications and hospital readmissions. Um, so the quality improvement change should increase patient satisfaction and, like I said, improve their overall quality of life if they follow this education provided by the providers. Performance data that will be generated will be the pre and post test that will be taken by the providers, any questionnaires or evaluations done by the patient and the healthcare provider of the implementation. Performance measurement. So per the policies per the facility for type 2 diabetics, so that will be um, used, and then also provider documentation of the education. So each patient that they provide type 2 diabetic education to, they should document it in their chart, and any kind of resources that the provider provided the type 2 diabetic with. And also we will track and trend the hemoglobin A1Cs of the patients. Communication of the quality activities. So a flyer will be created and it will be posted um, probably a week or two prior to the meeting, so that all staff members can know what is about to change within the facility or the clinic. And I will provide two different dates with two different times, so that way it'll kind of be feasible for everyone to attend. And the same will be done for those in a leadership role within the hospital. So I will provide them with two dates and two different times to attend the meeting. And also, a letter will be sent to type 2 diabetic patients via, they can run a roster of all the type 2 diabetic patients that they care for at this particular clinic, and we can send them a letter telling them what to expect on their next visit at their diabetic appointment. So the education. So we will do the comprehensive diabetic educational website, in which we will use, first we will do the diabetics test, that is complements of the Michigan Diabetes Association research and training revised diabetic knowledge test. And after they do the pre-test, they will do the educational session via the comprehensive diabetic educational website. And then after that, they will do the post test at that time. And this should increase their or improve their knowledge of type 2 diabetic education. PAL-ETAL in 2018 found that existing healthcare services and education programs may not be adequately meeting the needs of the patients. So this is why we are aiming to do this particular intervention. So the evaluation. So effectiveness of the program will be based upon the healthcare provider's pre and post tests, the type 2 diabetics hemoglobin A1Cs pre and post intervention or education, and then those evaluation sheets by the patients to evaluate the providers on the education that they provided them with, and also the survey evaluations from the healthcare providers about the intervention. These are the references, and that is the end.